Simple, accessible, free, and easy. That's what comes to mind when you think of the COVID-19 vaccine. But why are some still worried about getting the vaccine? And what can be done to reduce hesitancy? You're about to find out those answers and more in Part 4 of the COVID-19 Vaccine Safe series. I'm Nicole Silvey. We are pleased to be joined by two special guests who are working hard to promote the COVID-19 vaccine in our community. Melissa Robinson is the president of the Black Healthcare Coalition and councilwoman for the 3rd District in Kansas City, Missouri. Reverend Williams is the founder and CEO of the Calvary Community Outreach Network. He's also the leader of Calvary Temple Baptist Church, and we want everyone to know we are using physical distancing and other COVID-19 safety measures in this interview. First, to both of you, what do you see as the benefits of getting the COVID-19 vaccine, and how important is the vaccine for keeping the Black community safe?
Absolutely. The number one thing is around safety and knowing that we are addressing issues where we feel safe. We feel safe to be in the community. We feel safe to be around our friends and families. But then just, opening up and being able to be the social human beings that God created us to be. And so that is the most important thing as it relates to the vaccine and the benefits of us being able to connect with one another again and being able to participate and live full, vibrant lives.
That's so true, Melissa. And when I think of this, Reverend, there are implications for our whole community, but specifically our Black community. Why is this vaccine so crucial and vital for us?
Yeah, it's been a tough year, and we've sustained so many losses. Someone put it this way, they said a cold in the white community turns into pneumonia in the Black community. And I think because of so many other conditions, our immune systems tend to be a little worse. Our access to care seems to be a little bit worse. And those are some factors, just a couple, that contribute to the problems that we have.
Thank you so much. That vulnerability makes it even more critical for us and our community. And you said it, we've had so many losses, not one more, right?
Not one more. I think, we as a congregation decided early, not to gather. And we wanted to keep our seniors and our folks safe. And so we had to learn how to do the virtual thing, and we had to learn how to, connect a little bit deeper. But flip side, it's technology that we're learning how to use, and I think it will be beneficial in the long run.
Absolutely. And when I found out that we could get the vaccine and it was available, I was first in line to be able to do so. So I'm fully vaccinated, and I know that both of you are as well, and we are thrilled. So tell us, for those that are uncertain and maybe some who are thinking about getting it, how did your experience go? How was it for you? And we'll start with Melissa.
Yes, it was a seamless, well-organized experience. It was something that, it's just like getting your flu shot every year, something that is, routine. There are, no side effects for me. And so it was just a sense of relief, a sigh of relief, especially when you get the second dose and you know that you are not only protecting yourself, but you're helping to play your part in protecting the community to help to address the tragedy and the situation that we're in with the pandemic and all that it's caused.
Thank you so much. What about you, Reverend?
Full disclosure?
Yes, please.
I wasn't trying to do it.
Right, that's real talk.
I really wasn't, and so I'm one of those that had the conspiracy thing going.
Sure.
And I'm chronically distrustful of institutions that historically maybe have made mistakes along the way. That's a chronic thing. So I wasn't going to do it. I didn't want to do it.
So what changed your mind? Because you're here now. And it's
well,
exciting.
my mom is over 90. I wanted to make sure she was safe. My wife has some chronic health issues, and I wanted to make sure she was protected. Because of what I do, I'm out a lot in the public, and I've been telling people I can't carry anything back home to my wife. Because I'm doing me, and so I think it's really time for us to do, not me, but us as a community, and help us to survive, and not just survive, but to thrive. And it wasn't that I was scared of the needle, although I did shake a little bit, and I didn't pass out, and I didn't cry. I manned up. I went and took it, and I said, "When are you going to do it?" And she said, "It's already done." It's already done. And I had no real symptoms, little itch at the injection point, but it both shots came off seamless, and so I'm glad that I did. And I'll tell everybody I did it. I'll tell my congregation. I have told my congregation that I did. I've sent folks to get the vaccine.
Thank you for your leadership and your transparency, and the hesitancy you shared is something that we know goes throughout our community in many ways, and for you to share that and your outcome, I love the not just me, but us. That's it. That's going to resonate with me. I did have tears when I got my vaccination, but they surprised me with tears of joy because I felt a sigh of relief too, thinking about my parents are in their 70s and my son, and I know Melissa is the proud mom of two handsome boys as I am, and knowing that my son could see the grandparents and spend time together, those family moments was crucial to me. Reverend Williams, you were mentioning hesitancy, and why does there hesitancy exist within the COVID-19 vaccine?
The distrust level has just been just terrible. And I was looking at something the other day, and blacks and white evangelicals are kind of running neck and neck to see who can be the most hesitant. Is that a prize? The most hesitant award? And I don't want to win that one. It's not Republican versus Democrat. It's not that. It's about living or not living. It's about being free or not being free.
Pastor Williams talked about the historical distrust, and I think that we do need to circle back there and talk more about Henrietta Lacks and the Tuskegee experiment, the syphilis experiment that ended in the 1970s. So it's not like it's been so far removed. And the current medical racism that happens every day when we think about infant and maternal mortality, and we think about how Black body shows up into these medical spaces in which African Americans are seen as being more tolerant for pain. African Americans are seen as not being compliant. Many of our doctors are taught when they're training to become physicians that African Americans are non-compliant. And so we come from a place that there's never a patient that's non-compliant, there's an incompatible treatment plan. And so making sure that our physicians are aware of the harm that and the power that they have and the harm that they could be doing from an implicit bias perspective, and sometimes not so implicit, but it matters right now, today, the experiences that African Americans are having in our medical spaces, because that just continues to fortify the distrust. There are individuals that may not read the history books, they may not know the history, but those stories are translated through our culture.
You don't have to go all the way to Tuskegee. You can stay right here and say, what was it, General Number 1 and General Number 2. We probably don't have time to discuss all of that, but there were two hospitals, and they didn't want my kind in one of them.
Right.
And when I go to the hospital, if I have to go, I don't want them to think I'm just there to get pain stuff. Right. I hurt, my skin color should not be the precipitating factor of how you treat me. It just and so there are a bunch of reasons, a bunch of scary, horrifying, unjust reasons.
Yeah.
So we talked about education, and the Black Healthcare Coalition is really doing intentional work around this and programming, especially the Science is Safe campaign. Melissa, can you speak to that and what other things the Black Healthcare Coalition is doing at this time?
Absolutely. So the Black Healthcare Coalition, we're a 30-year-old nonprofit organization started by doctors, and physicians still play a very heavy role in the implementation and execution of our work. And so we knew going in that, understanding how clinical trials work and understanding research, that the vaccine was safe. But in dealing with our community, especially the African American community, as Pastor stated, the historical distrust, we want to make sure that our community always understands that they have agency, and that they agency over self, and they have the right and the responsibility to make choices for themselves, and not to just be told to, you're going to go, you need to do this. And so we didn't do a campaign that said, the science is safe. We, put a question mark there because we wanted to make sure we take a moment to educate ourselves on all the facts, and then make educated decisions about how we move forward to protect ourselves and our community.
You said something so powerful that I'll lead into Reverend Williams, but we talked about accessibility in terms of access to get the shot and the vaccination, but we need access to the information, the education, and that's what this conversation is a part of, but what both of your work has been. And so Reverend Williams, in that vein, what are some of the key messages that you're giving your congregation? I know you shared your personal story, powerful, but what are some other things and key information that you're providing?
Well, I think some of the long-standing fights have been about equity. Everybody has the right to live and to receive the care. Secondly, I believe that on any given Sunday, when you look at where African Americans are around 11 o'clock, there's a big percentage of us that are in somebody's church. And so we're working with UMKC to do some research projects, some education projects that will arm the faith community. And as my colleagues herald the message from their pulpits or their webcasts, we want them to have accurate information. We want them to have the tools that they need to make sure that their congregations are safe and protected. One of the first things that we did was convene a group of faith leaders for a town hall meeting. Some were dead set on not closing their doors. Some did. They were in a hurry to get back. And so we wanted to arm them with the right information. Whatever decision that you make, do it with good information, not just on a wild impulse. Okay, there's a song.
You sing too.
No, I'm not trying to do that. And so here's the lyrics. It's been a long time coming, but a change has got to come, and we're the change. We're the change agents that can do this. We can do this, guys. We can. Brother Imam, we can do this. Rabbi, we can do this. Bishop, doctor, reverend, pastor, we can do this. We can do this. We can do this now. We've got to do it. And I hope you'll join in with us. One thing I'm not sure if we said this or not, Nicole. It's free.
That's right.
It's free.
It is free.
Free works for me. I like free.
Right. Thank you so much, and I'm looking forward to the next time we see each other. We can greet each other with hugs the way we want to, and we can share space as we continue to get the rest of our community vaccinated. So thanks again to Melissa and Reverend Williams for joining us on the COVID-19 Vaccine Safe Series. To find out where you can get the vaccine, visit the website vaccinefinder.org or follow KC Vaccine Watch on Twitter. For more resources, go to bluekc.com.